This question comes from a therapist. We will call her Jalisa, who is feeling stuck in her work with a family. Names and details have been changed to protect privacy. It reads, "Hi Melinda, I'm working with a family who is facing a bit of a crisis. An adult daughter, age 24, recently became verbally assertive regarding her anger toward her parents. She claims that her dad was abusive during her childhood and is demanding a public apology. The parents, dad 55 and mom 51, are still married and live near the adult daughter. They are active in adult daughter's life and were supportive when she faced a divorce and became a single parent. Both of the adult daughter's parents have previously admitted and apologized for the adult daughter's chaotic childhood. They report it was due to dad's lingering effects of his own childhood trauma. The adult daughter states that the previous apology was not enough. Parents report that the adult daughter is being unreasonable and aggressive in her demands. All parties agree that they want to move forward, but it appears as if they only want the other side to make progress." Jalisa continues, "I feel stuck. How would you work with this family? Thank you in advance for your help." Before we explore therapeutic interventions, I want to thank Jalisa for writing in and for her work with this family. I will try to help. First, so I would validate all parties. They all have various perspectives and feelings, and all are valid. Next, I would employ some DBT interventions to ensure they each have adequate coping skills to manage triggers and unpleasant emotions. In doing so, I would also watch for their respective windows of tolerance. I would not move forward with deeper therapeutic work until I was sure that they each had the capacity and outside emotional support to deal with the unsettling emotions that the work stage of therapy can bring. I would also create individual safety plans with each person just in case. Considering the background and current intensity, it's possible that one or more parties could be close to the edge. We want to make sure that they all will remain safe while seeking proper support. Next, I would utilize psychoeducation to help all parties understand rupture and repair. I would normalize the messiness of family dynamics and life in general, and help them each have an opportunity for their version of the rupture to be seen and heard. Then, we would explore options for the repair. When appropriate, I may use some silliness or humor to loosen the constraints of seriousness and to widen the blinders. Sometimes just learning that there are other options helps relieve some of the pain and anxiety. We cannot assume that all people have great intentions or interpersonal skills at all times. We must remain aware of the possibility that someone is very different in our sessions than they are in real life. We don't want to unintentionally collaborate with a secret manipulator. For this reason, while contemplating repair options, I would help each member to practice healthy boundaries. Throughout this process, I would engage the family in therapeutic activities during session and/or for homework. Some things I'm thinking of off the top of my head are body posturing exercises, a complete the picture activity, a complete the task with no instructions activity, and a pretend to be the other family member while discussing a neutral topic activity. There are probably therapist-sounding names for these interventions, but I don't remember them at the moment. If anyone knows the names of these interventions, please leave them in the comments. Throughout the sessions, I would remind myself and my clients that therapy is a process. Healing takes time. It's a marathon, not a sprint. We are planting seeds for a beautiful future. There is no need to rush. Again, thank you for your email, Jalisa. I hope I gave you some inspiration or useful ideas. If anyone has any other ideas for Jalisa in her work with this family, please leave them in the comments. Thank you for watching. If you enjoyed this video, please like and subscribe. Join Heal Play Love University as we explore how to heal, play, and love. Until next time, remember you matter.